Good afternoon, everybody. Thank you for joining our webinar today. My name is Katie Haber, and I'm the Deputy Director for our Substance Abuse Program at the Council of State Governments Justice Center, and I will also be your moderator for today's discussion. I first want to start off by thanking our partners at the Center for Health and Justice at Treatment Alternatives for Safe Communities and at the Addiction Technology Transfer Center Network for co-sponsoring this webinar with us today. I'd like to briefly talk through a couple of housekeeping items about how the webinar is going to work before we get started. Anytime during this webinar, you can ask a question by typing it into the Q&A panel on the bottom right-hand portion of your screen. We will keep a running list of the content-related questions that we receive and then ask the panelists to respond to the questions during the last segment of the webinar. We're going to do our best to get through as many questions as possible today. If you encounter any technical or audio problems during the webinar, please call WebEx Technical Support at 1-866-229-3239. Please understand there are some technical issues that we may not be able to resolve, and for this reason, we're recording this event, and we'll post it on our website at csgjusticecenter.org/NRRC. We should have this webinar posted online early next week, and once it has been posted, we will also email you a link of the recording. This is a snapshot of the Reentry Resource Center's homepage for those of you who are not familiar. We are constantly adding new content and resources to our website, and we also send out a monthly newsletter that provides information about the latest research, funding opportunities, distance learning events such as this webinar, and other news about reentry. To sign up for the newsletter, please visit the link that you see on your screen after today's webinar. Before I introduce our speakers for today, I would like to provide a bit of background information regarding this webinar. In my work with the Reentry Resource Center, I often hear that one of the most challenging aspects of a reentry program is effectively retaining clients in community treatment as well as engaging families. As we know, engaging clients in community treatment after incarceration is extremely important as it increases recovery rates and contributes to decreasing recidivism rates, both of which are extremely important to the reentry process. As a result of these common challenges, the National Reentry Resource Center, in partnership with TASC and ATTC, is bringing you a 5-part webinar series on client engagement in community substance use treatment. Today's webinar is the 3rd part in the series, focusing on utilizing a systems approach to support post-release engagement and retention in community treatment. The first 2 webinars can be found on our website. We hope that you participate in all of the webinars and participate in a dialogue on how to effectively engage clients in treatment post-release. So I'd now like to introduce our featured speakers for this afternoon. Our presenters for today's webinar are Jack Charlier and Janelle. Jack is the Director of Consulting and Training at the Center for Health and Justice at TASC, and Janelle is the Director for Corrections and Community Reentry Services at TASC. We are thrilled to have both Jack and Janelle with us here today. And with that, I'd like to now turn the webinar over to Jack, who's going to say a few words about our co-sponsors to begin his comments. Jack?
Yes, thank you, Katie, and good morning or good afternoon, depending on where you are in the United States. To everybody, thank you so much for taking the time to join us on this webinar today. The first sponsor I'd like to mention that we set up front was the Addiction Technology Transfer Center Network, the ATTCnetwork.org. You've got the slide in front of you. Let me just say simply the way I think about them, because here at the Center for Health and Justice, we have a very good and close relationship with our local ATTC, which is the Great Lakes ATTC. It's the middle orange section on your map there. Is when I want to know kind of the latest and best information around behavioral health or substance use disorders and how to bring that research into the world of practitioners, I think of the ATTC network. And I invite you to do the same. On the screen on the left-hand side, you have a map of the regional centers in the United States. Find where you're located and get in touch with your network. Your local network center, and on the right-hand side, you have 4 areas that provide national focus areas for centers, and those also may be areas of interest. And those are national, so it doesn't matter where you're located. And we are pleased to be partners with the ATTC network. For myself, I'm with the Center for Health and Justice at TASC. You can see on the screen we do public policy, research, consulting, and training, grounded in, and this is what really makes us unique when we talk about our work that we do, our consulting and training work, grounding in 35 years of ongoing operational experience at the intersection of criminal justice treatment and community. What that means is that we are not a consulting agency, we're an actual operational agency working throughout the state of Illinois in the courts, prisons, probation, parole, and community. And I'll let Janelle say a little bit more about that in a second. And so our consulting and training is being informed every day by us as practitioners, where our staff, about 300 staff around the state, on a very regular basis are doing the exact work that each of you are doing, and that then allows us to do our consulting work. So it's not done from theory or concept, it's done from actual practice combined with research. And so that kind of puts us in a unique position, we think a very strong position when working with practitioners in the field like those of you on the call today. Kind of work we do here at the Center for Health and Justice, the systems change, of course. We are the systems change people, we like to say, when we think about the intersection of justice, treatment, and community. We do a lot of Affordable Care Act work, sustainability work for program, Winter Circle. We are the technical assistance provider for Texas Christian University tools. Many of you are probably using the TCU tools. Civic reentry, what does that look like? And then supervision of the substance use disorder offender. Now, website is at the bottom, centerforhealthandjustice.org, and I certainly invite you to contact us if anything that's on this slide or we talk about today around systems change or anything else seems of an area where we would be able to work together. Let me now introduce or turn it over to Janelle to talk about TASC.
Thanks, Jack. TASC operates, as Jack said, in the state of Illinois. We are a behavioral health case management organization, so we're not a direct provider. We provide case management services to people in the criminal justice system, throughout the criminal justice system that have behavioral health issues. Some of the key components to our case management services are ensuring that somebody who is involved with the criminal justice system is quickly enrolled into treatment, that they're retained in treatment. So we do a lot of work with the treatment providers that we work with to ensure that somebody is not only retained in treatment, but successfully completes their treatment episode. And when all of those things happen, what we see is that there's an improved chance of recovery, and I'll talk about durable recovery a little later in my presentation, as well as the individual being crime-free. And we do all of this in the context of being accountable to the criminal justice system. So there is very frequent communication with the criminal justice system about the progress of the consumer. And so that's a little bit about TASC and the operational work that we do.
Good, thank you, Janelle. And the Center for Health and Justice is a division of TASC, and that's how we tie in our consulting work, as you heard me say, to our actual ongoing operational experience in the same arena that each of you who are attending this webinar is doing. All right, so for today's webinar, we've got a quick outline, very simple. Part one, about systems. I will do that. And then part two, application of client engagement. Janelle will do that, and then we'll have, of course, a Q&A session at the end. We start off with systems because it's very important to know before you begin a venture around client engagement and you're going to engage all these different entities that you work with is, do you actually have a system? And what does that mean if you don't? What does it mean if you do? What are the benefits of kind of putting the energy and resources into creating a system? And why would you actually want to undertake that? And then Janelle in part two, we'll go over the items you see on the screen. That is, okay, now that if you know you have a system and you've built one, how do you do reentry from a systems approach, a systems perspective, and then the benefits that can be derived from it. And ultimately, of course, one of the benefits that we want is this sense of outcome around a client successfully moving into recovery, which we also want them to have a crime-free life that follows that. So two parts to the webinar for today. Our learning objectives, you have those up on the screen. I pointed a few items as a former trainer that I almost always read verbatim. So excuse me for this one slide. I will not do this again. Our learning objectives, define a system and know its key features. Understand a systems approach. Know the 4 levels of systems partnerships. Know the 11 benefits of a systems approach. State the 3 purposes of a systems approach. And understand how to apply a systems approach to improve client engagement, retention, and outcomes. So just want to make sure everybody does understand those learning objectives. At the end, you will hopefully have been able to receive all this information. Well, let's go ahead and get started. And right up front, we're going to say, this is kind of a question I like to just put out right up front, or something like to say, well, why are we doing this, right? We've got all sorts of things that we're doing each and every day. Why should we undertake a systems approach? The first thing that's real obvious is that we want to create what we call durable systemic change. So durable means that it's going to outlast any of us. It's going to outlast change of people who are elected and come in and put in different directors or different staff or different policies. We want something that is going to be able to withstand the different pressures that every organization and agency that's part of the system has, so that the good work that people do and that the good outcomes that come from that are able to withstand that. And so we want something durable. It means that it's lasting. That's important because I'm sure each of us has been involved in efforts where we put a lot of energy into something, and 6 months, a year, 2 years later, it's no longer around. And there could sometimes be good reasons why it's no longer around, but we want to kind of minimize that and be real smart about those things that we engage in as energy and effort and initiatives, so that they in fact do last. And if not, then maybe we shouldn't kind of do them in the first place. That's a different story, but the idea is certainly that they're durable. The next reason, or the next purpose actually of taking a systems approach, is to go to scale. What we mean by going to scale is this: is that if you could do something of good value, get good shared outcomes for 5 people, but your system has more than 5 people in it, why not do it so that you can do it for 50 people or 500 people? In other words, if it's good for 5 and fits 5, let's find the 50 people that can now get the benefit out of it, and that the system and the public and the community can be made safer, with reduction in recidivism, lower costs, whatever it may be. That's going to scale, and that means reaching more people. That means making things better, right? So the idea that it's good that a small unit can do something, or a small cross-section of different organizations can do something, but if they're making something better, let's let everybody, or as a large cross-section as possible, make something better. It can correct errors. Certainly we are in criminal justice, we're in a system where there's a lot of pieces and information of data and people exchanging things, and errors do occur. And a systems approach can help correct errors, so that if one organization says we've made a mistake, and that mistake now has rippled down through other agencies and organizations, without a systems approach, you're left with that one organization saying, via call for, or I've done something wrong with the other agencies and the other parts of the system, not really knowing kind of what they're supposed to do to adjust to the error that happened. And so systems approaches allow us to correct the errors across multiple agencies and organizations. Another reason is to reverse injustice. Certainly, we can look at research that has come out, as well as our own anecdotal experiences around kind of who's in criminal justice, why they got there, how they got there. And in order to address some of these larger scale societal issues that criminal justice faces, without kind of getting into the right or wrong of them, you really do need all the parts of the system in agreement, saying, yes, we view this as an injustice, we view this as a wrong. And so all the parts of the system must come together to address it, not just the police or the courts or treatment or probation or parole. Everybody has to agree that this is something that we want to do differently. And then finally, I call systems approaches really your bank above proposition. And this goes back to this idea of creating durable systemic change. That if you're going to put energy and effort into something, and of course we don't know the outcome of everything, we don't know what something is going to turn out to be, but we want it to be successful. The question is, are you going to try to do something on your own for a small amount of change that may or may not affect the system? But there may be times, of course, where that's relevant. You just are kind of changing up your things internally. But in criminal justice, where there is a lot of relatedness between organizations and between operations, it's really kind of incumbent on us to say, is there a bang for buck proposition around us partnering together to do something to get to that larger scale impact, to reach more people, to make it durable? And I think the answer for many things, but not all, is a systems approach. And when we don't take a systems approach and we're trying to influence other organizations, we're very likely to fail, by the way. We're very likely to fail. So it's a bang for buck proposition on a systems approach. So I'm going to invite you, and I normally do this presentation interactive. We're not able to do that today, but I'm going to invite you to think about your present situation right now, and that's this. Think about your organizational system partners. So who is part of your system? I'm going to kind of give a 30-second pause here to give you time to think about that. Who is part of your system right now? However you define a system, doesn't matter. And what do your partnerships look like now? And I'll define partnerships in a few slides, but just kind of give that some thought. for the next 30 seconds or so, who are your organizational system partners? Who are they? If you think of a person's name, think of the agency that they work for or organization. It could be a faith-based organization, could be a chamber of commerce, could be a government agency, it doesn't matter. But who is part of your system, and what do your partnerships look like now? What I mean by that is, what is the depth, the richness of them, how complex are they, how much do you share with resources, people, information, or just an occasional wave across the street every once in a while, which some people call partnerships and could well be the best that you could do. But let me just give you a few seconds to think about that. Who is part of your system? What do your partnerships look like now? Okay, and at the end of the webinar, you'll see kind of a closing version of this, so keep that in mind here as we go through the presentation. So let's start by saying, well, what is a system? Or answering the question, what is a system? Now, this is a very technical definition, but it's relevant when we will get to Janelle's part about the practical application. So a system is two or more parts that interact with each other, right? And they form a whole, a functional whole. So parts that interact to form a functional whole. Seems pretty simple, right? It has a boundary. And all we mean by boundary is that there is some limit to how we define the elements, organizations, agencies of that system. Know that we're not talking about people here. We're talking, as you've heard me say, about organizations, agencies, entities of that type. So it has a boundary. So, for example, when we think of criminal justice or the school system or the medical system, we would say, well, some things are in that system and some are not. So for the medical system, the local grocery store is probably not a part of the medical system. And so that would define that the grocery store is outside of the boundary versus in the boundary of that system. Then again, of course, you could say, well, there's a pharmacy in the grocery store, so that pharmacy then becomes part of being inside the boundary of the medical system. The point is, you get the idea. Some things are out, some things are in. And it's important when you think about systems to do it in a way that is realistic without getting kind of too blue sky, right? Because we all live in a very large system called the world, and we could all kind of get stuck thinking about that, and it would get real deep and probably not very far. The idea is it has some kind of boundary. And systems have inputs and outputs. And so when we think about inputs, right, we think about things going in, right, that's pretty simple. And when we think about outputs, I'm just going to draw the arrow in the same direction, it doesn't matter, we think about things going out. Now the interesting thing about a system is this, is that within a system, these things are supposed to kind of loop around, right, so that things go in and out of the different parts of the system. Something comes in to one part out and then back into another part and out. It kind of loops around inside of the system until it finally leaves. And so something, when it leaves the system, is done, hopefully, and correct or right or whatever it may be. So as you're thinking through your system, think of, well, what's coming into one part of the system, a part being the organization, and what's coming out of that part. And then when you put all the parts together, kind of what comes in and what comes out and when can it leave. So this is a very simple definition of a system, and we'll see if we can, a little later on here, get back to this definition. Okay, so what are the features of a system? So if we know what a system is, a system has two very interesting features that really help us kind of understand in a system or not. So first one is, when it's all together, something occurs that no individual part can do. So no individual part can do this if these pieces were all not put together. The other part of a system, or the other feature of a system, is that if we take away certain parts of it, it doesn't function the way that it should, or that it used to when that part was in there, and we're not able to achieve our outcomes. So the top one is called the additive quality of the system. By adding the things together, we get something new, right? And new doesn't just mean more of something. It means something that no individual part can do. The bottom part of a feature of a system is called the reductive. When we take something away from it, it no longer works. So intuitively, both of these make sense. If it was just a matter of putting pieces of the pie together, we would just get bigger and bigger things, but whether or not they're actually working together is not being answered. And the system works together, right? It functions as together as a functional whole. And if certainly we get the idea that if we took something away from something and it didn't work anymore, that we would say, well, right, something's missing from that. So those are the features of a system. And again, just a reminder, since I normally do this in a very interactive way and we're not able to today, if you do have questions, please feel free to ask them as we go. I have no problem with that, so that I can get your questions also here. Okay, so let's think about systems. Now, these are kind of two things that you'll see when you do systems work that are brought up often. It's called the rats and the elephant. So hopefully this is a little bit fun for everybody. And of course, I can't see the looks on your faces. Sometimes when I put this slide up, people give me weird looks because you don't think of these things together. But let's go ahead and give this a shot anyway. So the rocks. You see a picture of the rocks on the screen, and the question is a pile of rocks a system? Is that a system? That's the first question. I'll let you think about it for a few seconds. Is a pile of rocks a system? So maybe if you're sitting at a table with a group of people watching this webinar, you can kind of discuss this. Let me see if I can try to answer this. So when we think about a system, two or more parts that interact together. So we can see that the rocks are in the picture. They're touching each other, right? So they're interacting. That counts as interaction. That form a functional whole. Certainly, while this pile of rocks, we don't know how high it is. It may be flat, but we can think about a pile of rocks that could form a wall, for example. Wouldn't be a very strong wall because you can kick it over. There's no mortar or anything binding it together. But a pile of rocks are two or more parts that interact together and form a functional whole. And then the question is, do we have any boundary to it? And of course, rocks have boundary, and a pile of rocks has boundary. Well, sure, we have boundaries. Now, inputs and outputs are really kind of not a good fit for this example, so I'll skip them, but we're going to kind of get to this, whether or not pile of rocks now, and that is this. When we put a pile of rocks together, do we actually get anything out of that pile of rocks that the rocks themselves were not already doing? In other words, is there anything new that comes out of it? And this is where systems theory tells us, well, a pile of rocks is really not a system. There's nothing new comes out of it. There's nothing that's inherently different about a pile of rocks versus a single rock, other than that they're piled on top of each other. And while this may seem like a goofy example, the reason that this is used is because we find that a lot of things that people think are actually systems are not. And in criminal justice, it is clear from just experience to me that we sometimes pile new things onto old things or just more of things, and we call it a system, but they're not actually interacting. They're really just a pile of rocks. We're bringing kind of new pieces in, but it's not clear how or if they're connected and how well they work together to get us to kind of a better place, something new and something different, although we now have more of things. And more of things is interesting. It has budget implications. It has resource implications. To have more parole officers, to have more treatment. But whether we're getting to better outcomes, that's the real question for systems thinkers. And for the work that we're presenting here on the webinar, do you just have a bigger pile of rocks or is something happening? And that takes us to the elephant. Now this is also kind of weird. I think the idea is whoever thought of these a long time ago said, well, let me just kind of put out two things that really are a little bit different for people to conceive of. And so the other one is the elephant. Now, is an elephant a system? Again, I'll give you a few seconds. Is an elephant a system? Okay, so again, whether you're on your own or you're with a group, maybe you got a chance to think about it or kind of say a few things to each other about it. So it's an elephant a system. Two or more parts, absolutely, that come together, interact, and function as a whole. Of course, an elephant's a living being like us, so it fits that. It certainly has input and output, if you've ever been to a zoo. We can think about that, so we know the answer to that. And it has a boundary, right? It has skin that kind of holds it in, and we know what it looks like and what it's facing, so we get that. So the features of a system. So when we think about the features of a system, is an elephant a system? So the additive quality is to take all the pieces of an elephant or the parts of an elephant. Of course, you see a whole elephant on there. Do we get something new if we just have the tail and the trunk and the legs? We put it all together. Do we get something new? And of course, the answer is yes, because an elephant is alive. And when we think of our systems, we want to think of living beings, and sometimes you'll hear people refer to systems as living organisms. Well, that may or may not be true. In other words, they may be describing really a pile of rocks, actually. That could be possible when they really want to say the elephant. Yeah, an elephant all put together does things that by each of the individual parts could not do. And then the final feature of a system is if you kind of took away parts of the elephant. It's kind of a grotesque example if you think about it. But if you took away parts of the elephant, would the system stop functioning? So if you kind of took away the trunk of the elephant, right? So if we did that, if we took away the trunk, would you still, would the elephant be able to drink water or make noise? And the answer is no. You took away the tail of an elephant, would it function as before? No, it would not. It would be functioning. The tail of an elephant, as I've come to learn over the years, is used to kind of swat flies and keep it cool because it has no way of reaching its back. So a pile of rocks is not a system, but some of our systems look like this, and we use the word system. An elephant is, in fact, a system because it fits the features, not only what is a system by definition, but the features of a system. So kind of two different examples, but I offer them to you because they are kind of interesting to think about versus maybe some of the other things you've heard about it. But think through and say, remember the opening question, what does my system look like? Who are my partners? You had to classify it right now, and I know I can't see you, but would you say, well, it's more of a kind of a pile of rocks right now is what I really got, or do I have an elephant? This is important for what Janelle is going to talk about, because if you got a pile of rocks, you're really limited on what you do. You got some work to do before you can start doing client engagement from a systems approach. If you've got the elephant, you can begin doing some of that work right away. Okay, so here's a question for you. Is criminal justice a system? I want you to think through our definition of a system, two more parts that interact together. There's a boundary, there's inputs and outputs, and then the two features of the system. And just take a few seconds with your group or on your own. Is criminal justice a system? Now, you've got up there the elements. I'm not including anything more than what's up there right now, but is criminal justice a system? Okay, well, let's give this a shot. So, some people say, by the way, that criminal justice is a system. Some say it's not. The importance, again, for you in this webinar is to say, if I'm going to do a systems approach to client engagement, I have to know if I have a system or not. So that's really the relevance, because if you do have a system, that means that certain things you can begin to do right away to work on client engagement. If you do not have a system, then you have to first build that up before you can begin that type of work. So the criminal justice system, is it two or more parts that interact together? Here's one part, here's two parts, here's three parts, four parts. I've never mastered writing with a mouse after all these years, by the way. So yeah, it's two or more parts interact together. This part interacts with this part, which interacts with this part, and so on, and it forms the functional whole. Let's just say that that kind of fits. It has a boundary, right? There's a definite boundary to the criminal justice system. Out here, outside that box, we don't include, I used the same thing before, we don't include the grocery store, we don't include the oil change place. There may be other places that we do include, or they're not described here, and that's fine. The point is it has a boundary. And it definitely has inputs, it has things that come into it, right? And some people think that the criminal justice system, its inputs are people, but really that's not true. Its inputs are what we call cases. And I won't go too deep into this, but the reason it is that all crimes, or almost all crimes, have attached to them victims in some way, shape, or form, and the public is attached to each and every crime. So when we think about systems and criminal justice, we're tempted to say, well, it's the offender, the client, the person, whatever terminology we use, but it's really not. It's the case. The person had a victim. That victim is interacting with the system, and the public is interacting with the system. And so this green box that you see around the system is actually very porous. It has a lot of places where you can kind of go out and a lot of things that can come in beyond just the front end of the police and the back end, right? The citizens can make complaints along the way. They can, the treatment community can be involved in different places. Victims can come in and out of the system. And so when you think through your system, that open question, you say, well, gee, do I have any of the public in my system? Do I have any victims or victims advocacy groups in my system? So don't think of the justice system as processing people. It's processing cases, and a case has a lot attached to it. Okay, so it seems to fit the criminal justice as a system. And here's where it gets a little tricky. The question is then, does the system as a whole do anything different when it's all put together that comes from something about these parts being added together? And this is where you can really give an answer and say, no, the justice system really doesn't do anything kind of together that doesn't come from each one of these individual parts, right? Now we know then that's the additive quality, but we know that the reductive quality, which means taking pieces away of a system and it has reduced function or outcomes, that is true. So, for example, if I were to take away this part of the system here, number 3, prosecutor, defense, attorney, defendant, jury, judge, sheriff, this back part of the system here then would have tremendously reduced functioning because they wouldn't get any cases from the prosecutor, police, or judge. So criminal justice does have this reductive quality which says really we all need each other, but the additive quality is not as clear. It's not as clear. So then what does this mean to you? What's the implication to you? Well, if you're going to do systems work in criminal justice, I offer to you, and this is probably where most of you are, and what you want to do, let me pick out a big color here, is you want to think of your system this way, in a vertical slice. That's how you want to think of your system. There is really big picture work that goes on with the dark green outer box, and that's big picture systems work. But depending on where you are, this may be the better slice for you. If you're really going to focus on the courts, and I drew these lines, they're not exactly correct, but you really want to focus, for example, on the courts and do your work there. Because when you do that vertical slice, then you can begin to pull in other parts of the system that are not up here. So what also exists over here are things like treatment, right? You know that treatment exists as part of the courts. We know that, and you say, okay, now I get it because they're part of my system. This is where you can also have faith-based community. Oh, there goes my writing. Writing with the mouse is never easy, so you can have a faith community and so on, and now you have this vertical slice that actually does meet the definition of the system. So the moral of this story, and we've shown you this, is don't go too far left and right. If you haven't done systems work or you don't have a strong system, first just build vertically and kind of go out beyond this dark green line and go into the community and treatment world and do your systems work out there as a beginning point. And then you can think about, say you're the court, then you can think about going to the police or going to corrections and parole, all of which should be done, but takes time and experience to know how to navigate those waters. Okay, moving right along. So then what is a systems approach? So when the parts of a system, you already know what that is, 2 or more parts, are moving towards the same end, practicing mutual relatedness. Now that sounds like a funny term, like mutual relatedness, kind of an oxymoron, like Jumbo Shrimp. If it's mutual, of course it's related. The idea is that we understand as individual organizations in the system, we understand that we have a relationship with one another, and that relationship is important to me and to you as separate organizations. And it's important for all sorts of reasons that go beyond just because I need you. We support mutual success, and mutual success means, and it's kind of the next step up of mutual relatedness, mutual success means that I care about whether or not you succeed, and I'm going to contribute, here's the trick, I'm going to contribute to your success, even if I've done all my work completely well, exactly as people expected, and then some. I'm going to contribute to your success by sharing resources with you so you can be more successful. That's a really scary proposition if you think about it in a world of declining budgets. The reality is, and the reason systems work is gaining more and more prominence in criminal justice treatment and community is because of declining budgets saying we now must share all our toys in the sandbox. We're not going to have enough toys individually to get us to where we need to be. So it's supporting mutual success means I care about you, you care about me, and I'm going to share some resources with you so that you can be successful, because when you're successful, I'm successful. And then finally, working towards shared outcomes. In fact, I will tell you that if you really want to know one simple definition of whether or not what you've built is a system, all you have to ask is every organization bring them in, put them at a table and say, what is the outcome that you are working towards that we also are working towards? And write it on the board with a number attached to it. Now, I'm being a little goofy by putting a number or a percentage on it, but that's real. If different organizations cannot have a shared outcome, you're not taking a systems approach. You're doing other things that may be good, that may be valuable, but you're not all in agreement of a few simple outcomes that you want to achieve with a numerical indicator on it. A percentage change in this, a percentage increase in this, X number of things happening within this time frame. So this bottom one here really kind of is the one that will set you up as, are you doing systems work? Well, you have shared outcomes. If you do, and you're working towards them, you are. If you don't, then I'd say you're probably not. Doesn't mean that you can't get there. It doesn't mean that you don't want to not do systems work in certain areas. that's fine. Okay, so when we talk about systems work, you've heard me use the word partnership. I've asked you to think through the partnerships. There's a reality to what partnerships are, and I kind of come up with these 4 levels over the years. Coexistence, this is where a lot of us are. This is your pile of rocks, literally. And that is, we're just acknowledging that other organizations exist, and we'll send them stuff back and forth, but that's about it. We don't go to each other's holiday parties, and when we park near their building, we don't even think twice about it. Communication, we're talking to each other. Maybe we go to each other's staff meetings. Maybe our executive directors or CEOs or directors, whatever it is, get together every once in a while. And we share some information we know exists, and that's about it. Cooperation. Now we're beginning to do some things together. We're beginning to get to that mutual relatedness. We're still not really sharing resources, right? Although we may begin to in kind of some simple ways. But the idea here is that we are doing some things together, and you may see over time then the value of that and the power of being able to bring the scale of some work that we're all doing. And then finally, collaboration, and that really is, again, as we said, about shared outcomes. So when I asked you at the beginning to think through what do your partnerships look like, I haven't shown you this yet. This is what I'm referring to. So you had to write down all your organizations. What would the levels at which you would put each of those in? Collaboration, by the way, as we said, is really what's needed for a systems approach. Very simple. When I do this live, I take teams of people through this exercise. You write down, as you can see, very simple, all the organizations you collaborate with in the middle. Next ring is cooperate, communicate, coexist. You get the idea here. The idea is you do want organizations in each circle, and you can't collaborate with everybody. You have not enough time in the day. And there may be some in cooperate, you need to bring collaborate, some in collaborate, you need to boot out to communicate. And part of the partnership map helps you understand, do I have the right people in play, and do I have the right numbers also, because you have so much capacity. So that's the systems partnership map. You can certainly do this exercise on your own. You get kind of the idea of it. Benefits of the systems approach, last 2 slides before I turn it over to Janelle. Let me just comment on just 2 of the items up here, so Janelle can go in depth in a practical application on some of the benefits of the systems approach. One is, and this is a really, really important one that's not intuitive until you kind of do systems work like we do often enough, and that is language, this idea that to the treatment world, to the community, to the criminal justice world, different words for different meanings. We all know that, but what's not intuitive is how easily we say those words and we use those words, and we don't realize that our encoding of that word, we kind of went through this last week, our encoding of that word means one thing, but the decoding of that word by the listener means something else. And the one that I have always complained about since I kind of began to be familiar with the literature around risk needs early on in the 90s was this word risk, which, I say, God bless the researchers. I hate the fact that they use the word risk, because as someone who has spent time in the public eye in criminal justice, whatever, you would say, if you would ever go to the public and say, yeah, this is a high-risk person, what is the image that they have in their mind, right? An extremely dangerous person running around on the streets doing all sorts of bad things. But what does high risk actually mean within the framework of risk and responsibility? It doesn't necessarily correlate to a high public safety risk. It means that the likelihood of our intervention is high that that will fail, and that they need more of what we have to offer because they present a lot of challenges, but it doesn't necessarily mean a public safety risk. So that's one where understanding language is important, and I try never to use that word high risk with kind of lay people, because they will absolutely understand it in a way that I do not need it, and the research does not need it, nor does our field necessarily need it. And then finally, the bottom one is demonstrate confidence in approach. Really from an organizational standpoint, especially for those of you on this webinar who are in leadership roles, if you stand up and say to your organization that we should do X because X is the right thing to do, and your partners in the system are doing Z, Y, or something completely different, not even on the alphabet, it really begs the question of why are you doing X on a staff member? I look across and someone else is doing something different. It's a really good question for line staff to ask. Why aren't we all doing this if it's so good for everybody? And a systems approach says to all the organizations in the system, to the community, the treatment, to the world at large, we all can come to agreement on these kind of processes and policies, and we all agree that they are where we should be as a system. And so the sense of demonstrating confidence in approach is, again, one of the non-intuitive values or benefits of taking a systems approach. Okay, and then one more slide here, and I turn it over to Janelle, and I'm not going to read this one. So here's some more benefits of the systems approach, and you can read those. You have those there. Again, developing of shared outcomes really is the definition then of systems approach, and to know whether or not you are doing it. Okay, so with that said, and I'm trying to hold that up. Okay, so with that said then, let me go ahead and turn this over to Janelle at this time. Janelle?
Great, thanks, Jack. So I'm going to spend my time talking about how we apply the systems approach to one of our large prison treatment programs and reentry programs in Illinois. So basically, to use what Jack talked about earlier, how did we go from the rocks to the elephant in Illinois in this particular program? And it's important to start with, where we started. So we started as many agencies, many partners working both inside and outside of the prison. Some community-based staff working full-time in the prison for the first time. Each with our own mission, vision, and deliverables. So we started this program as agencies, each having their own mission, their own vision, and their own benchmarks and things that they were accountable for. So for example, when we look at TASC, we were accountable in the reentry program for ensuring that people, for example, completed their community-based treatment. Whereas the employment provider, both inside and outside of the prison, was accountable for making sure that people had a resume before they leave prison. And then when they were in the community, that they found employment and retained employment for 30, 60, or 90 days. So when we started this program, we each had our own mission, vision, and things that we were accountable for. And I think the other thing to note too, as we started, that's important to note as we moved to a system, is that for many of us and for many of the agencies, it was the first time we worked together. So a lot of the organizations, we didn't have institutional history with each other. Many of us were new to each other. And so, it took something for us to go from an agency system to a true system. And I want to talk a little bit about how we did that. So let me just say first that, we started the program in the early 2000s, and within the first couple years, we were really getting very good results, and results that really measured up to like programs, across the country. So it wasn't that there was necessarily anything wrong, but we just saw an opportunity. We saw an opportunity to take a really good program and make it a great program. And one of the things we started grappling with is how do we move from an agency-based program, if you will, to a system, to a true system. And so we started that process by forming the Reentry Program Oversight Council. And that group really took on being accountable for ensuring that the reentry programs operated consistent with a systems approach. We brought together representatives from all the organizations that worked either on-site or in the prison or in the community. So we brought together people from the Department of Corrections. We brought together people from the community-based treatment agencies, from the faith-based organizations. So our Reentry Council really brought together representation from all of the agencies that were part of the reentry program. And I want to say too, I don't think I mentioned this earlier, the timing of this was really a few years in. So, once we got off the ground, we were implemented, we were seeing good results, then we really felt like it was time to go the next step and really look at how a systems approach could impact our program. And the other thing too, the council included former consumers. So we were really committed that as part of this process, that the consumer voice was heard. And so we did include some former consumers as part of our council. And so we formed the council. So Jack and I were actually part of the formation of the council. And then we started to grapple with, well, what do we do? What do we do at the first meeting? How do we start getting people to think about a systems approach? And so we really looked at that and really came to this fundamental question that we started with at our first council meeting, which was if each agency, whether you're working in a prison or you're working in the community, if you're accountable for ensuring every consumer achieves durable recovery and that every consumer does not recidivate, what would your services look like? And would you be doing anything differently? So let me give you an example about how we were doing that from a ROS approach, so from an agency-driven approach. And then I'm going to talk a little bit about where we moved to. Let me just go ahead for 1 second. I just want to make sure everybody's clear when I talk about durable recovery. What do I mean by that? So durable recovery is lasting, stable recovery that the consumer is managing independently in the community. So Jack talked about a durable system. Here we were looking at what system could we design that would have consumers move to durable recovery and not recidivate. So recidivism, how we define it in our state, in the state of Illinois, is a return to prison within 3 years. So in an agency-based system, the questions that we normally ask ourselves, I'm going to use an example of a treatment program, for example. So you're a community-based treatment program. And so what your focus is, what you're accountable for, is ensuring somebody completes that treatment episode. And so that's what you're focused on. And what we started to look at in coming from a systems approach is if, as this treatment agency, you're accountable for the consumer achieving durable recovery, and you're accountable for them not recidivating, how would your services look then? Would you be doing anything differently? And that's really the premise that we started the council from. So I want to take a few of the things that Jack had up on the screen a couple slides ago, a number of the benefits that programs can achieve as they move to a systems approach. I want to talk about how we were able to achieve some of these benefits in our own system. And so one of the benefits of the systems approach is uniformity of message. So you heard me talk about how we on the council grappled with, everyone focused on durable recovery and the consumer not recidivating. That really became, if you will, our system mission. But it was equally as important that didn't just stay with the council members, that we were able to take that to all the staff in all of our agencies. And so there were a number of things that we did to achieve that. One is we did a lot of what we call immersion training. So we actually brought people together to really immerse themselves in the whole system and how the system operates and how the system looks when it's aligned around every consumer achieving durable recovery and not recidivating. We did a lot of meetings. We did different events. And so really, it was our commitment as the council members to ensure that message was getting out to everybody and that we began to operate from that message. On one of our other messages, there were really 3 key messages that we gave, that we came up with in the council that then we rolled out to the staff. And the other one was that we're all aligned in ensuring consumers build recovery capital. So what I mean by recovery capital is those things that a consumer can build towards, whether it's a job or stable housing, but then that capital helps support their durable recovery. And so another message that we took to all of the staff through the trainings and the meetings that we had was that all of us are aligned and all of us are accountable in ensuring that every consumer builds recovery capital so that they can achieve durable recovery. And then finally, we really shifted the focus. And another message that was really critical to the formation of our system was focusing on diversion when there was no eminent public safety issue. So, historically, and, in many of our correction system jurisdictions, whether you work in probation or parole, oftentimes there can be a focus on violation and return to jail or return to prison. But we really took the approach and the message that our primary focus was on diversion when there was no public safety risk. And how can we all work together to ensure that when it's appropriate, someone is diverted and not violated. And so those were the key messages that we developed on the council and the key messages that we rolled out to the staff throughout the system. And so we took those messages and looked at how do we foster communication, which is really another benefit of a systems-based approach. So how do we ensure that now those messages are getting into the work that we do? And one of the primary places that we focus was on many of the joint staffings that we do where agencies from the different staff, the different partners participated. So we took those key messages to our pre-release staffing. So we have 2 pre-release staffings that we do in the prison before someone leaves. And the preliminary discharge staffing is the staffing where we talk about what somebody's going to need as they exit the prison. What kind of treatment services are they going to need? What is their housing situation and what might they need around housing, family support. So again, we brought those key messages to this staffing. So if we are all focused on building recovery capital, durable recovery, and ensuring somebody doesn't recidivate, then those are the messages that we need to bring to those staffings. Those are the things that we need to be focusing on as we create a reentry plan. And then also at the parole discharge staffing. So parole discharge staffing, we do 30 days before somebody leaves the prison program. And that includes the people that are going to be working with you when you're released. So your parole agent that will be working with you, your task case manager, oftentimes the treatment program participates, the housing provider, and again, having those staffings really center around those key messages. How can we support you in building your recovery capital? How can we support you in achieving durable recovery, and how can we support you in not recidivating? And again, repeating that on the outside when somebody's in the community. So, a couple different staffings that we do, the integrated staffing, the treatment discharge staffing, all of those staffings began to focus on those key messages of the system. And so I want to give you another example about fostering communication that's a little bit different than putting it into practice in the work that you're doing with consumers. So we had a particular issue that we were dealing with after we formed the council. And it was a bit of a discrepancy by a number of the people on the council about what should come first. Should treatment come first or should employment come first? And so many of us on the treatment side were, of the opinion that treatment needed to come first, that it was critical that somebody focus on their treatment, and without starting their treatment, ensuring their recovery was solid, the chances of them becoming employed were, not as great as if they were stable in their treatment. And so, but then we have an employment provider who clearly their mission and the things that they were being measured on was how quickly they could get somebody employed. What was the retention? 30 days, 60 days, 90 days. But instead of them saying, hey, we have this issue, what they did is they started to look at what was happening with their benchmarks, and what they were seeing and what they were finding is that consumers were getting jobs, but they weren't retaining jobs. And so what they did, instead of trying to solve this issue on their own, they brought it to the council. And they said, we want to create a work group made up of council members to really tackle this issue of what comes first, treatment or employment, when is it appropriate to start the employment process, because we believe that a more ready client is more likely to retain their employment. And so there were a number of us on the community side that came together on this employment work group, and really through the course of just a couple meetings, we came up with a joint definition of what ready to work meant on the outside. So when is somebody ready to work? And so jointly we agreed that how the system would function around that is that somebody needed to be stable in treatment before they were ready to work, that they needed to be making progress on their treatment goals, and that they were in compliance with TASC and parole. And that once those things were achieved, that we, TASC, would notify the employment provider that this person was ready to work, and we would refer them to the employment services. And that really became an opportunity for all of us to come together and kind of redefine how we work together to ensure that the client was stabilizing their recovery in the community, and that when it was appropriate, then they were starting their employment search. And so that's just an example of how we impacted the system through this council. You know, Jack talked a lot about a system truly being a system when you develop shared performance measures and outcomes. And I want to say that, I want to let you know that we spent a fair amount of time on this. And once, you know, the council agreed on its messages, we rolled those out. The next thing we tackled really was creating those shared performance measures. And so all of us had benchmarks. All of us had things that we were accountable for in our different agencies. And so what we asked the membership of the council to do is to present those benchmarks to the council. Not with any percentages or what we wanted to shoot at achieving with those benchmarks, but just what are they? So, you know, some of the examples that different agencies presented were the percentage of successful completions for prison-based treatment. So how many consumers are successful in completing the prison-based treatment? And the prison-based treatment provider was accountable for that. How many consumers achieved 30 days of employment? And again, the employment provider was accountable for that in the community. And then TASC and the treatment providers were accountable for what percentage of consumers are completing their community-based treatment episode. And so we spent a number of meetings having everybody present just what are your benchmarks. And then we moved into a process where we jointly, all of us, reviewed everybody's benchmarks and came up with a performance measure. So instead of the treatment agency saying, well, you know, we believe 65% of the consumers will complete community-based treatment, all of us had input on that. So the employment agency had input on what the treatment benchmarks were. The treatment agencies and parole had input on what the employment benchmarks were. And so really through this process, what we ended up with was not only benchmarks, but our shared agreement about what our performance should be all throughout the program. So I just want to end with, you know, so what difference did that make? What happened as a result of all of that work, really moving from, you know, the rocks to the elephant? And I think there's a number of key indicators and performance measures that really highlight what we were able to accomplish in moving to a system-based approach. One is that for the last fiscal year, 98% of our inmates leaving prison had a treatment intake appointment in the community schedule within 7 days of their release. Now I can tell you, when we first formed the council, that was more like 14 to 21 days. And so through our functioning as a system, we were able to improve how quickly we're able to schedule those treatment appointments on the outside through our collective work. And I will tell you that most of the appointments happen within 3 days of release. So again, we moved greatly in terms of our ability to get people into treatment very quickly upon their release from prison. 83% of the parolees completed their community-based treatment episode, and that was also for last fiscal year. So again, when we started probably it was somewhere between 65 and 70% of the parolees were completing their community-based treatment episode. We've moved that through the work of the council, through creating this system, to now 83% completing their community-based treatment. And when you look at what just general treatment completion rates are, this far exceeds what you're seeing not only in general completion of treatment rates, but completion of treatment rates for a criminal justice population. And then finally, we were able to reduce the recidivism rate. I apologize for how old this benchmark is. I wasn't able to be able to officially quote what our current recidivism rate is, but I will tell you that it went down again. But in fiscal year 10, when we look at those Sheridan parolees, which is our program, that completed community-based treatment, 32% of them, out of the whole pool of everybody that's ever gone through the Sheridan program, 32% have recidivated compared to 50% for the control group. And again, unofficially, that 32% has gone down again. So I leave you with the difference that creating a system can make, not only for the work that you're doing together as partners, but the impact that has on the consumers that you're serving. And I think I turn it back to Jack.
Yes, thank you very much, Janelle. Great job. So in closing here, before the Q&A, we're going to end up kind of where we started, but instead of thinking about your present, ask you to think about your future. So what could your future partnerships look like? What could they look like? Is that future worth it to you? This is a huge question, right? You heard the webinar, you heard about systems, kind of the concept, and then the application, or theory and application. Is it worth it to you? It's a heavy lift. You heard Janelle say that. It is a heavy lift. It is not easy work, and it often requires the assistance of outside organizations to kind of make it go. And then if you do think, yeah, this is worth it, we want to get the system-level type of shared outcomes to get the real bang for buck, scalable, durable proposition that the public expects of us, that our funders expect of us, that we expect of ourselves as professionals in the field tasked with stopping crime in all a variety of ways we can do it, then is what you need to do to realize that future. And I like to call it the better future. What do you need to do to realize that future? So these are just some questions for you to think through, certainly after the webinar with the team that's watching, or as you go back to your colleagues and kind of bring this to meetings and say, I wonder if we should do a systems approach. These last three questions and the bottom two in particular really are key. So with that said then at this point, we'll move to Q&A. Katie?
Yes, thank you, Jack and Janelle. Really appreciate all of your comments. They're very, very helpful. We do have some time for questions, and as a reminder for everybody, you can ask a question by typing it into the Q&A panel, which is located on the bottom right-hand portion of your screen. We already have a few questions that have come in, so I'll just go ahead and get started. One of them sort of goes back to what you both were talking about in terms of agencies and when agencies form a system. One of the questions is, each agency, and I think that this was, may have been particular to criminal justice, but has competing and different initiatives and priorities. And so the question is, what is really needed to get all of the parts of that system to come together for the overall good? For example, would you recommend an overseeing agency that sort of starts this process of a systems approach, development of a task force, et cetera? So if you could talk a little bit more about that, that would be helpful.
Sure. I'll take a quick stab at it, and then, Janelle, if you want to follow up just from the experience with the REPOC here in Illinois. And Janelle and I actually did that together, but I'm going to let her kind of take all that thunder. So conceptually, from a system standpoint, the entity, whatever that may be, like REPOC, the Reentry Program Oversight Council, or an actual organization, should serve the purpose of building the system and no more. So it could be that in a smaller jurisdiction that merely, and I'm going to be kind of funny about this, but I don't mean it because it's actually a very powerful thing that smaller jurisdictions can pull off much easier than bigger jurisdictions, and I really like that about small jurisdictions, a smaller size one, is that literally it could be a once-a-week breakfast of the executive director, the chief of police, the chief judge, chief of probation, a few community leaders, who get together and begin the process of saying, do we want to do something together, and if so, can we find what that is? And that breakfast then turns into kind of a roundtable, and from a roundtable then it turns into something that has a little bit more structure with it, but not so much that it's kind of a burden to the agencies or the system itself. So that's kind of at one end, right? You do need some structure because in order to develop shared outcomes, that means you've got to do some data collection. That means that there is some element of structure that goes with this. Doesn't mean policy procedure necessarily, but it does mean structure. To the other end, where you get larger kind of systems together, so I see New York is on the webinar, for example. Having been out there, if they were to do something with New York City as a city in its entirety instead of just say a single borough, and even then it's large, there you may want a more established type of structure. But I want to give a caution note. Systems have limited resources, and the more resources that are put into the entity that is doing the systems work, the more those resources are pulling from the entities that in fact are supposed to be doing the work to get to the shared outcomes. So I'm giving a general answer, but the idea is don't jump in with anything in mind other than what's the least amount of system structure we need to get our agencies working towards that shared outcome. And it could be as simple as, and again, I'm saying this humorously, as just a regular ongoing breakfast that then turns into a lunch because the breakfast just gets a little bit long. It doesn't have to necessarily be its own structure with funding and staff and anything like that. Janelle, do you want to add anything to that?
Yeah. So I think that question came in before I described the Reentry Program Oversight Council. So I just want to make sure that it was clear that that really was the function of our Reentry Program Oversight Council that Jack and I started. That was really Jack's idea, so I don't want him to steal the thunder. That really was the group that was charged with moving us from agencies, rocks, if you will, to moving us to a systems approach. And so it was really through the membership of that group that was Department of Corrections staff inside and outside the institution, community agencies inside and outside, faith-based consumers. It was that group that really took accountability for us moving to a systems-based approach.
Great, thank you. We've had a few questions along this line, so I'll try to summarize a few of them with this one question. And that is, how do you approach an organization or group that may not think being a part of this sort of systems approach and being a partner is really viable for them? And this person in particular was talking about sort of moving through the levels of partnership, but we've received some other questions as well about how you might want to approach other organizations to get them involved and what your thoughts are for that.
Mm-hmm. Janelle, do you want to go first? You want me to say something?
Go ahead, you go first.
Yeah. So organizational relationships are really a lot like our personal relationships, and the word I'm using is relationship. So there may be common points of contact between two organizations individually. Someone may know someone else there. That's a very informal way, but a way to start it, and that could be a way to go. The other way, especially if you're going to try kind of the more traditional, executive director to superintendent, kind of the hierarchical approach, is to take a look at mission and vision and organizational history. So mission and vision, which can seem somewhat dry, actually for mission-driven organizations is a really good place to start, to say, well, we're about public safety, you're about public safety. And I'm just using public safety as an example. It could be all sorts of things. And so since we're both about public safety, can we sit down and talk? Not to be funny about it, but I will tell you that if you ever want to get partnerships going, throw a nice meal. And I'm not being funny about that. It's a great way to get people. And do it at lunchtime and bring them together and say, let's just get together and have a conversation, and lunch is on me. It's kind of one of the things that is overlooked as kind of too simple, but it's a great way to just start that conversation. Know that along that path of you reaching out to other organizations, some will say no to you. And you need to understand that, and that's fine. Right? That's the way the world is. Move on. But if you think that they're worth it, mission, vision, personal relationships, get that going. Give it the time it needs. Don't jump into all the detail too fast. You have to kind of pace it out. And then see, and if it doesn't work, it doesn't work. That's okay too. Maybe 6 months, a year after you've got your, whatever this system, partnership, coalition looks like, maybe then they'll say, oh, I'm really interested in that and I'd like to do it. Or maybe you come to find out, which I ran into, that someone else, in fact, was starting their own kind of venture that was a system-based approach, and you had to think through, gee, should we maybe not start our own and instead kind of go with this other grouping over here instead?
I think the thing that I would add to what Jack said is that the initial group that really started talking about taking this on was a fairly diverse group to begin with. And I mean diverse from the standpoint of we represented both DOC staff and community-based agencies. And so we were able in some cases to I'm going to say go after because it's the thing that's right there for me. We were able to go after some of the agencies that were a little more resistant from our own perspective. So, if there was resistance inside the Department of Corrections, Jack and another person that worked with us on this, they would go to those people. If we were experiencing resistance in the community, I would go to those people. And so sometimes we would come at it from kind of our life mission. And, the other thing I would say is, what's in it for us? What's in it for you as an organization? What's in it for you? What do you see as in it for you in your service delivery that could really have this be, a very powerful experience for your organization? And so we did some of that as well.
Great, thank you. We have a question on the specific role of corrections as part of this overall partnership. And the question is really focused on this reentry process and was wondering about your thoughts on how corrections personnel are involved in reentry planning and exit staffing, and sort of why their role is critical both before release and then after release with community supervision and that sort of thing.
Jack, you want me to start that one?
Yeah, I think that's a good one because you're still doing this work.
Yes, exactly. They are involved in all the processes. So when I put up those staffings that we do and the fostering communication slide, we have Department of Corrections staff involved in all those staffings. And so it varies based on the staffing and whether it's inside or outside. And it's not just the staffing. It's really in, a great deal of all the work that we do. So we have, on the inside, we have the corrections counselors involved in the work, both from a staffing perspective. Sometimes we'll do, we'll do emergency staffing. We'll do special kinds of staffings if there's an issue. They are always involved in that process. When we start moving to the reentry plan staffings and the discharge staffings, now we insert parole, and we also have a parole resource group that really is accountable for showing up the resources that are available to our parolees, and they're involved in that process. Everyone is involved in the work of developing the reentry plan. So each agency, each DOC entity is involved in contributing and developing that reentry plan. And then as we shift to the community, again, the parole resource group, parole, and so it's really all of us working together around those, key messages that I talked about earlier. So they're really involved in, beyond the staffing, and all the staffing, but, again, in the majority of the work that we do. So it really is a DOC agency partnership, I would say.
So we had a question about the oversight council that you were talking about, and wondering if you could talk a little bit more about any outside members or voices that you involve. For example, people in recovery, family members, etc.
You want me to take this, Jack?
Yes.
Okay. We did involve consumers. So we had a couple former offenders as part of the council. They were offenders that, former offenders for many, many years. But they were a full part of the council, a lot of the working groups and subgroups that we had. So they really, were an equal voice at the table in terms of how the system should look and operate. We did not have family members.
And I'm going to add one thing into that, and that was kind of towards the end of my time there. We were doing the initial conversations with victim advocacy organizations, the very early conversations with them. Those are ones kind of to the earlier questions of how do you have organizations that may not see alignment from something like this. And those discussions probably would have taken another year or two. You can understand why, obviously. And then also with veterans organizations. The very, very first discussions were kind of underway as I was moving on. So I want to throw that out, but the design was then to reach the kind of a larger civic audience. And the next one after that was going to be Chamber of Commerce, try to pull in some chambers of commerce into this. And then you really start seeing the power of systems impact if you think about those three organizations, and of course the names of organizations, not names, types of organizations coming into play. But so there was at least a kind of design for a wider reach beyond kind of a more traditional systems approach, which is fine too, because it's a very good place to be.
Okay, thank you. You both touched on this a little bit, but I think if you could say a few more words. One of the questions that has come in is asking about the links that you've seen between doing systems planning, systems integration approach, and the sustainability of that process and programs as a result.
Janelle, do you want me to go first on that? Okay, so let me do that. So on sustainability, I'm not sure that I can put a specific time frame to it. What I will say, because we do sustainability work also, is that sustainability should start on day 2, which means that day 1 is when whatever it is you're doing starts, and sustainability needs to start on day 2. The more common experience is sustainability starts towards the end as things are already in decline. So I'll throw that out. It's not answering the question because I don't have, other than anecdotal, kind of 18 months. I don't have that. But sustainability work must start very, very early on in the process. And the other thing that I would say on sustainability from the work we do that is more likely to then allow you to be successful is that the processes that are going on around the systems work, around the day-to-day operations of the work, must also include day-to-day sustainability work. And sustainability work, of course, is about keeping the vision alive and relevant in the future. That's really what sustainability means. So I know those are a little bit more general. Janelle, I don't know if you have some specifics if you want to fill in from the VPOC or otherwise.
Can you ask the question one more time?
Yes, sorry, I was on mute, a little slow there. So the question was really the link that you see between doing the systems integration and partnership approach, and really the link between that and sustainability of different processes that you implement as a result, as well as specific programs, and sort of talking about the potential link between doing the systems integration approach and sustainability.
That's a really interesting question because it has ebbed and flowed with some changes in leadership, changes in agency staff, and so you're constantly having to kind of restore and renew it in order for it to be effective. I think the thing that has really worked for us is that we've seen such great outcomes. And, I'm not so sure people would have I think people get discouraged when you don't, and they start to drop out of the process. And I think one of the things that really has helped us sustain this, and again, it's ebbed and flowed over the years too. I just want to be, I want to be clear on the picture. But the thing that's really helped us is, the outcomes we jointly see in all of our work, and the difference that this approach, made in taking us to really a great program.
Okay, thank you. So I think we have time for one more question, and I know that there are a few questions we're not going to get to today, and so you'll see my contact information at the end of the webinar, and you all can feel free to email me, and I can put you in touch with Jack and Janelle as well to answer some of those further questions. But for the last question, they were wondering what are some of the challenges that the council encountered during its first few years?
The startup of any new venture is the bigger part that at least I paid attention to. There are lots of things that I know Janelle was speaking to too, was getting people to believe that this was valuable for them to be involved in. The initial startup, even beyond kind of the first group, involved some people who were instructed to be there, some who came not knowing exactly why we're there, and then some true believers. And, for me as a leader, we're always trying to establish or help people establish why this is valuable to them, why they should spend any time doing this whatsoever versus everything else they have. And so the main challenge was getting sufficient traction early on through the development of relationships. And I'm going to let Janelle talk about the actual achievement of outcomes, but the development of the relationship so that the early version of REPAC, before it was called that, could be cemented together. And that's really a key thing, because remember, you have however many organizations with different cultures, with possibly different values or values misalignment. The missions are all somewhat in the same arena, people who don't know each other, and so you really need to have everybody believe this is worth my time to see it through to the point that I'm willing to continue to commit resources, go back to my organization, say good things about it, not badmouth it, and want to actually come and work on this and do it for a repeated basis before I ever actually see any success. So relationships, establishing value, and buying as many lunches as your credit card can afford is a good thing. Janelle, do you want to throw anything else in there?
Only two things, yes. One is, ensuring to people that this was going to continue. Because I think there was some skepticism about, we start these things and they don't continue. So I think that was another challenge that we had to overcome. And there's something I want to say that's a little bit unrelated, but I think it's important to say. We also had a number of researchers that were part of REPAC as well. And what was really great about that is they were able to help us dissect the system from a data perspective and really hone in on what we needed and wanted to focus on. And so I think with their engagement, it provided a lot of some additional credibility to the council.
Thank you. So as I mentioned, we weren't able to get to all of the questions today, and I apologize about that, but please feel free to connect with me at the email address that you see on your screen for questions about this webinar and other work as well. We're happy to answer your questions and put you in touch with Jack and Janelle for further discussion as well. Want to just quickly remind you that ATTC has a multitude of resources, a lot of which touch on what we talked about today. So you'll be able to sort of look at those resources and click on the links when we send the recording of the webinar to you all, as well as you can get those through the PDF of this presentation as well. So this concludes today's webinar. After you exit the webinar, a brief survey will appear on your screen, and by answering the questions in the survey, you'll be helping us improve on the services that we're able to offer you. So we greatly appreciate it if you just take a few minutes to complete that survey. As I mentioned, we'll email a link to the recording of this presentation, as well as a link to a PDF of the PowerPoint slides used in the presentation, likely early next week. These links will also be made available on the National Ranger Resource Center website, which the link again is on your screen in front of you there. And again, we also encourage you to sign up for the newsletters as well for some future notices about these types of webinars. I'd like to end by, again, thanking the folks who joined us today on the webinar. We really appreciate participation. And a special thank you to Jack and Janelle, as well as the ATTC and TASC for being on the webinar today. We really appreciate the time you put into this and all of your comments. I'd like to thank the Bureau of Justice Assistance as well for their partnership. And we look forward to having all of you on another webinar soon. Thank you again for joining us, and take care.